Hi, today we are going to see how a trainee perfusionist should approach for exam in UK. Trainee perfusionists are required to complete at least 150 cases under supervision before applying for practical exams. Two examiners will attend to examine the trainee. The examiner shouldn't have worked in the trust or the hospital where the examination has taken place for at least 5 years and known the trainee professionally or socially. On the day, the trainees will be assessed on their ability to conduct the cardiopulmonary bypass completely and safely in line with the local protocol and the society recommendation for standards of monitoring during cardiopulmonary bypass. The trainee must demonstrate that he or she can independently run the cardiopulmonary bypass machine along with the auxiliary equipment and critically evaluate a wide range of clinical parameters and be able to respond appropriately and safely with the suitable clinical treatment. The Society of Clinical Perfusion Scientists recommends that the trainees set up a clean pump using the suitable chosen custom-made setup on the morning of their exam prior to the case. If this is not possible, the society administrator should be informed prior to the exam day. The registered supervisory clinical perfusion scientist must be accessible from the examining department. The supervisor shall be present in the theatre with the student throughout the practical exam. The primary clinical perfusion scientist is a lead clinical perfusion scientist for the case. All fluids and drugs should be checked with the certified clinical registered supervisory clinical perfusionist. The examiners are not able to act as a second check. If the registered supervisory clinical perfusionists are not available, the drugs and the fluids can be checked with the anesthetist or registrars or qualified nurses in the theatre. Practical exam is pretty much like a driving test. A critical error should stop the exam straight away. Multiple minor errors would probably finish the practical exam but would not lead on to the viva. On the exam day, the trainees will be assessed on 10 different topics. Sitting in an examination is a nerve-wracking, particularly for trainee perfusionists who are sitting for practical exam where the two examiners are watching you constantly. My suggestion would be treat the last 25 cases as your exam case, each and every single case. Do exactly as the same way, then it becomes as a second nature. I always compare cardiopulmonary bypass to an aircraft. In an aircraft, you need to have a smooth takeoff and a standard cruising and then a smooth landing. So that's pretty much like a bypass. Smooth takeoff is smooth going on bypass, safe cruise is a steady bypass, safe landing is coming off bypass smoothly. In section 1, you will be assessed on how you select your disposables, testing and assembling, referring the patient notes, collecting the relevant data and the comorbid, having a replacement equipment in the theatre, for example, spare oxygenators and spare tubing set, and a spare cardioplegia system as well. Adequate stock of fluids and drugs for the case. The anticipation of potential use of other devices, for example, cell saver, intra-aortic balloon pump. In section 2, follow the department protocol while setting the pump up. Maintain the sterility, appropriate speed, accuracy and confidence. Also, heat exchanger should be tested. Whenever gloves is used to put the water lines, remove and wash your hands because there may be particles from the gloves remain in your hand. If you don't wear gloves to put the water lines, then you should wash your hands naturally. Section 3 would be priming the circuit. Must follow the department protocol, prime the oxygenator and circulate throughout the circuit. Adequate de-airing, setting up occlusions, appropriate level for initiating bypass, appropriate speed, accuracy and confident when completing the checklist and also signing off. Double checks should be done with the second perfusionist according to the department protocol. The fourth section is initiation of bypass. As I mentioned earlier, going on bypass should be as smooth as like a smooth takeoff. You should be confident, seamless transition from patient to cardiopulmonary bypass. You should be able to achieve the full flow without compromising the level. Understanding the fluid management options available. If you need blood, you need to add blood without compromising the levels. Add fluid or blood in line with the department protocol to achieve the levels. Understand the cause of level problems. Avoid large unnecessary swings in flows and pressure. Try to maintain a steady flow and a steady pressure. Also, you should be aware of impact of under or overflowing the patient. Maintain adequate and appropriate pressures with the use of vasodilators or vasoconstrictors. Reach the required temperature appropriately. You should have an understanding of flow and temperature, also the temperature gradient. Blood gases should be done according to departmental protocols. You should understand and maintain the normal range. You should also be able to understand the parameters measured, use and reference to the inline monitoring devices. When it comes to myocardial protection, follow instructions accurately and safely. You should be aware of flow, temperature, and the pressure. You should be aware of the potassium level during cardiopulmonary bypass. Section 6 would be communication. You'll be monitored on communication. Clear, concise, and accurate communication all the time. Be confident while interacting with the team members, particularly with the surgeon and the anesthetist. You should show your leadership as and when required. You should communicate any problem which arises during the cardiopulmonary bypass to the surgeon and the anesthetist. Section 7 is maintenance of record. Must be accurate and representative of the case. It can be an electronic or on paper according to department protocol. Section 8 is termination of bypass. Completion of bypass should be smooth and controlled. Good communication with the multidisciplinary team, and make sure with the anesthetist that patient's been ventilated.
Happy with ventilation, Gabriel? Thank you. I'm going to start filling. Yep.
And also unhurried by the surgeons. Be confident, be aware of pressure, flow, and patient response to filling. And the main thing is level alarm should not be switched off or should not be overridden until the venous line is clamped. If you switch or override the level alarm, that's a critical incident and that leads to a failure. Section 9, you'll be tested on aseptic techniques. Before you start the case, make sure the equipment is clean. Check the sterility of the oxygenator, tubing pack, and the cardiac pressure delivery system. Use aseptic technique when you're handling the oxygenator and the tubing while assembling the pump. All equipments should be used according to the manufacturer's instruction. The last section would be post-bypass procedure and disposal of cardiopulmonary bypass circuit. Be aware of the patient's condition before taking the lines off the table, and you should be aware of any further intervention, and the circuit should be disposed safe and clean. Any deviations from the department protocol will be discussed and explored in Viva, and you should be able to justify it. Regarding the Viva examination, approximately 45 minutes to an hour will be allowed for Viva examination. Each examiner may question the student on two main topics, and then which will lead into secondary questions as well. The questions can be around the exam what you have done. The questions can be related to the incident happened during bypass. The other questions can cover any area of perfusion. While you are answering the Viva questions, when a question is asked, you should have a questions to yourself like what, when, where, why, and how. And if you answer all these questions for the main questions, that will cover all the secondary questions. For example, if the examiner is asking you to talk about myocardial protection, then you should have a list of questions in your mind. Say, for example, what is myocardial protection? You talk about myocardial protection, then why it's done, when it's done, and how it's done. That will take you up to 15 minutes. And this internal questions will pretty much answer all the questions what examiners have asked you. I hope I pretty much covered all the topics and the events which can occur on the exam day. Good luck and best wishes for your exam and for your career. Thank you.